comes from the Eastern Shore Mental Health Association. Anita.
Thank you. We recently lost our only certified peer supporter for the Eastern Shore. He was relocated into transitional care and is no longer available to us for support. Will you commit to funding more trained peer supporters for our Eastern Shore? And when will it be? Training begins in June in Halifax.
Thank you, Anita. Okay, the first person to speak to this will be Kevin. With a K.
Thanks very much. Thank you, Anita, for the question. Mental health is certainly a big issue right across our province, right across our country. The loss of the peer supporter it's news to me. I wasn't aware of that. So we certainly would want to make sure that we take a very close look at what services are available to our citizens here on the Eastern Shore. I know in our platform there's a big commitment to mental health investment. There's a commitment to installing collaborative care centers, up to quite a number of them across the province. I know I've been advocating that the Twin Oaks Birches site is a perfect location for a collaborative care center, where there would be a team of health practitioners there that would include mental health services. So I'd certainly be advocating to not only replace what has gone, but to bolster and increase the services for the people of the Eastern Shore.
Thank you. Devin is next.
Thank you very much for that question. Mental health is an issue near and dear to my heart. I have not struggled with mental health myself, but I have been affected by the results of mental health on family members and friends. So to speak to this, I can speak very confidently to the investments that our platform outlines. One of the first ones is to double the initial investments into the mental health strategy. And that would cut the wait times for community-based mental health care just by itself. The other one would be to reverse the cuts that have been made to the community organizations and add an additional $150,000 in funding. Those are two very significant investments. While it's not going to solve all of our problems, it's a step in the right direction. Thank you.
And now the question goes to Randy.
Yes, thank you. I was just thinking about $150,000 being added to mental health. I don't want to be mean or nasty, but that's just a drop in the bucket. $150,000 wouldn't have allowed any of my clients to live a year in a good, comfortable, affordable, peer-supported housing. I recently, as I mentioned earlier, attended a session at the Forensics Hospital on behalf of a young fellow who was under a mental health order to change his life, if you will, and I told him, this gentleman needs safe housing. He cannot go back home because it's dangerous. Oh yes, we know that it's in the report. I read the report, it was in the report. They discharged him next week, and you guessed it, they discharged him back home in the same situation he just came from. 2 years he was in forensics, and all the money that was spent on doctors, nurses, lawyers, etc., to discharge that gentleman right back in the same situation, all because of, you know what, funding. In my lifetime of working with the mentally ill, I've had people jump in front of freight trains, I've had them jump off the Angus L. MacDonald Bridge, and if you want to pick a body up that's jumped off the Angus L. MacDonald Bridge, it's nothing but just flesh. There's every bone is broken. And I'm the one that had to go and tell the parents. I'm the one that had to ring the doorbell and say, your son and daughter has just committed suicide. It wasn't an MLA.
Thank you, Randy.
Thank you.
And Patricia.
Thank you for the question. I think the key word there that I heard was the peer support worker. So we're looking at one individual. So I ask, where is the government in providing the services that we need in Nova Scotia so we're not having our youth and other members of our communities die by suicide? I know the PC platform is investing $40 million in mental health and opening crisis centers all across Nova Scotia, which is a start. Like, I think all of us here are agreeing it's a start. This is a huge issue. I worked in the Department of Health and Wellness to establish a peer support program across the province. And because we know the evidence shows that peer support can be just as powerful as professional formalized services, and it will take the impact off of our emergency rooms and off of our community-based services. And to talk about community-based services here on the Eastern Shore, just wondering with the raise of hands, where do you go in this community for your mental health addiction services along the Eastern Shore? Where do we go? We go into the city because there's no formalized services out here. We have volunteers from the Eastern Shore Mental Health. So there's significant things need to change with the PC government.
Thank you.